Good evening, everybody, and welcome to the Salome Menstrual Hygiene Day. Today on our panel, we have three amazing panelists. We're going to be speaking about all things menstruation. And I hope today we're going to leave you feeling more engaged, more open to the ideas that we're going to have today. And before we do that, I'd like to introduce our lovely panelists. We've got Candice Chirwa with our red outfit here. And she is known as the Minister of Menstruation. Candice is a menstrual activist, she's an author, she's a professional speaker, and she's a social entrepreneur who's very passionate about menstrual education and fighting many myths and taboos and stigmas around menstruation. And to my left here, I've got Dr. McKay. Welcome, Doc.
Thank you very much.
Thank you. Dr. McKay is a medical healthcare practitioner and he's the owner of Goldman Medical Center with more than 28 years of experience in private family practice. Welcome, and I look forward to having more chats with you.
Thank you very much.
Thank you. And last but not least, we have the beautiful Miss Sebambo, Boitumelo Sebambo. Boitumelo is our CEO of 360 Biomedicine, a lovely dynamic company that has developed Salome range of products which aim to, help and create and deal with women's issues. Welcome, Boitumelo. Before we begin, Candice, I'd like to pose a question. You deal a lot with about myths and taboos, and I know as kids all growing up, we've always heard about these myths. Which is the one that sticks out to you and you've always wanted to be that one that we're going to debunk? What's the one that sticks out?
So I think what's really interesting for me in particular is just how these myths are very socially restrictive in terms of your behavior. You're told you should not do this, you should not do this. It's like a long list of thou shall nots. The first time one menstruates, that's the first thing we hear. You cannot do this, you cannot do that. And that's very restrictive. And I think we need to change the narrative with regards to how we have conversations about periods. Instead of it being approached in a point of fear, rather celebrate it, to say you're going through a transition from childhood to adulthood, and you are allowed to do whatever you want to based on what your body allows you to do. Yeah. And I just always challenge these myths. I mean, for instance, the craziest one for me is you cannot enter a place of worship whilst you're menstruating. And I always ask, well, is there a period detector at the church doors that if I enter, it goes, you're menstruating? No, there isn't. So why should I be restricted from that social activity that I want to participate in? So yeah, there's just a long range of myths that one can research, and you just will probably laugh at how ridiculous they sound. And I think just establishing a period positive world means we have to talk about these things.
Lovely. And just to add on what you said, I mean, growing up, we didn't have these conversations. So it's very lovely to see that, a young dynamic woman as yourself is open to speaking about period. Because growing up, that is a word that was never ever used openly. So I'm curious to know if you could explain to the viewers, what was the breaking point for you to get into the space and to have the courage to talk about period and be an advocate for period and all things menstrual. Right. Because that's something people don't do. So I'm sure you're going against the grain, but wanting to speak to. So what was the push for you?
I mean, I started menstruating at the age of 10. So that was a very young age. I was in primary school, and it was only 11 years later when I turned 21 that I actually started researching on feminist activism and sexual and reproductive health, thanks to my academic study at the University of Wits. And I realized that menstruation was an under-researched topic. So we'd always talk about it from the perspective of, hush, hush, it's silent, but never from the perspective of how is it viewed as a human rights issue. The fact that a natural biological function can be an obstacle to many to go to school, to go to work. And we're not having enough conversations in terms of policy, why we're not establishing these things in a public space, but also in a private space. What are we not doing in having these conversations? Because oftentimes young girls experience violence at home. If they stain their skirts or stain the bed sheets, they'll experience violence because seeing this period blood is so disgusting. Yeah. So for me, it was just so interesting seeing that the dichotomy of differences on the experiences of menstruation and how one person could be, experiencing silence and another person could also be experiencing some form of violence, all because of a natural event. Yeah. And that just sparked my curiosity to
and
research.
Something that they have no control over. That's
exactly.
Dr. McKay, in your medical space, what is your take on menstruation and menstrual issues? I mean, are doctors talking about this, or is it from a medical perspective only? What is your take on how it's evolving? The conversations are evolving. Do you think it's evolving even in your space?
So I agree with you. I think it is evolving in the sense that younger girls are more open to talking about it. Before, the girl would come in with the mom, and she would just sit there, and the mom would say, "Can you just, help her, and you know, what's the problem?" And the girl would be very, very hesitant to verbalize anything. And today they can come in and talk openly about it. They can talk openly about contraception. They can talk openly about the amount of pain that they're experiencing, the amount of bleeding. Is it normal? Is it abnormal? Doctor, please help me. I stay absent from school because of it. I sometimes can't get out of bed. It's embarrassing sometimes because of what we're facing. So we are moving in a great direction, probably not fast enough. And thanks to the activism around it and the more publicity, it is becoming a little easier to broach that sort of subject. So it's a good thing that we can raise more awareness around this from a medical activism, family point of view, so that we can all be on the same page in that sense.
I just want to say it's also not by mistake that we have a male panelist and while we're discussing period, because we never we don't ever include the gentleman in these conversations. I think it's about time that we change the narrative and have them be part of the conversations, have the boys be part of the period conversation. You know, your sons should know that if my sister's on a period, she's on a period. There's nothing to laugh about. Be more sensitive. Participate. Offer a chocolate or offer to go get the tampons or the pads. So it's really by no mistake that you're here, because I think we're trying to open up the conversations to the guys to say, guys, be part of the conversations. Let's change the narrative. Let's change who's having these conversations so we can actually see some change happening. And I don't know if you've had any experience, if you have with as men. Talking about period, I mean, in your circles, do you find it's very uncomfortable for the guys to have period talks with their kids, or?
Yeah, absolutely. Look, and I mean, in my situation, my wife would look at me and say, "But you the doctor, can't you have these conversations?" So I said, "No, but I'm their dad. I'm not the doctor here at home."
Exactly.
And every time I get invited to do a sexual education talk at school, look how quick you're off to go to that school. You can't even have it with your own children. So I'm part of that guilty one, but we're getting there.
But then, Dr. McKay, are you seeing more fathers coming in with their daughters into your surgery? Because that would be an interesting turn, where it's not just mothers.
In my practice, no, unfortunately. No, it's still very, very much taboo. It's, if anything to do with, it's a girl thing or a woman thing, mama better take care of that, or let her go alone, or granny, for that matter.
So we still have a lot of work to do, ladies. Still a long, long way to go until we have the fathers coming in, or in the lines at the shops buying those products. We still have.
However, can I just add, it's my daughter comes to me when she's in, "Daddy, please go and crush this. Daddy, please go and get this." And I have to walk into a public place like the pharmacist and say, "I'm here for my daughter, I need this and this and that." And I have no problem doing that. Because I know she's at home and she's in tremendous amount of pain. And I do anything to alleviate that. So she comes to daddy.
I think a lot of times men in particular get so scared when they have to interact with any form of menstrual product. So I remember seeing some gentleman looking at the different period pads, and he didn't know which one to pick. And then when he was trying to take it, he started shaking. And I think oftentimes we need to remind them that we know these are not for you. So you can walk freely with this product. It's not going to attack you. It's not going to bite you. More than anything, it would be very empowering to see that more men are getting involved in buying these things, going to the pharmacy, asking for period pain, and asking simple questions like, what can I do to help when you're menstruating? So it's really important that we put men back in menstruation. I think the word men is there for the reason, and men have every right to be a part of the cycle that we're going through.
And debunking the myths. They're really a big part of that.
Boitumelo, can you maybe just take us through what does Salome have to offer, and what are the conversations Salome is having? What do they hope to do within this space when it comes to period talk?
So I think in a nutshell, we say Salome is science for men's health. That's in a nutshell, but expanded on that, Salome is a range of products which is herbal extract based, and we look at how do we either offer solutions or treat women's health issues such as menstrual pain, heavy menstrual bleeding, polycystic ovarian syndrome, based on lots of data and research around certain herbal extract. And that's really what we want to do. We also want to offer women alternatives to current treatments, very herbal based, very natural products.
Boitumelo, you mentioned that Salome is natural products, and why do you think there's a growing demand for women taking more natural products as opposed to your regular quick fix, over-the-counter painkiller?
Look, I think it's because menstruation is a lifelong something that happens to us lifelong. So you can't really, women are choosing self-care, but women are also making decisions of what type of medication, what type of treatment do I want to commit myself for the next 30, 40 years. So I think the choice towards, or the move towards herbal-based, towards natural product is growing from that perspective. But also I think the other thing is women are looking at, if I am bleeding a lot, if I am having pain, is this natural? Should I be undergoing this? And this is why there is that move. Women want to educate themselves and empower themselves about their bodies. So from that type of research, then women put their hands up to say, what can I do? What is the alternative for this kind of thing? Should I be on contraceptive for the rest of my life? Or should I take something else? And I think that is why we're seeing the growth.
Candice, in relation to the Salome products and what they have to offer, what are the common problems or questions that you've been your girls that you interact with, the mothers that you interact with? What are the common products related to periods are you exposed to?
I think oftentimes the question we get asked is it normal to experience this amount of bleeding? Is it normal to experience this amount of pain for these amount of days? Especially with young girls who are not entirely sure how the pain must feel, how long the pain must go on for, will it be there for the rest of their lives? So I think oftentimes the go-to is these medications where you just have to go and get like Schedule 3, Schedule 4 medications for young girls, not knowing that there are alternatives. So in our workshops, we usually just cater to say, use a hot water bottle or drink ginger tea, so that at least you're not always just relying on having a dependency on this medication at such a young age. So oftentimes I think we're not having enough conversations about how menstrual pain should feel like, because we assume it's stomach cramps, but you're not actually understanding the process of the fact that your endometrial lining is shedding with an unfertilized egg, and you're going to feel some form of pain there, but for how long, and for and in terms of how intense should it be, and also understanding that period pain is different for different people. So for instance, someone who has endometriosis type of pain is very different to someone who probably has pain on birth control. And it's just a matter of having these conversations, and also just informing young girls to say you have to always ask, and if it doesn't feel normal, go and see a doctor.
And Dr. McKay, adding to that, what are the long-term effects of women who leave these issues too long, don't do much about it, or constantly just popping pills that are really a short-term solution? I mean, what are the long-term effects in that?
Yeah, so it's so important, as you mentioned, that they need to know what is the possible causes, what could be the possible causes of severe pain, what we call dysmenorrhea. And for some it may be normal, but what if it's not? What if it's due to some organic or gynecological cause, such as endometriosis, such as a pelvic infection? Now, pelvic inflammatory disease is a severe illness, which can lead to something long-term, such as infertility. What if it is PCOS, polycystic ovarian syndrome? What if it is a fibroid, the tumors, muscle tumors on the womb itself? So without knowing what is the actual cause behind it, and then leaving it and just popping pills all the time, could lead to long-term complications. And especially something like maybe needing a hysterectomy before you've even had children, leading to permanent infertility, leading to long-term painkillers, being addicted to over-the-counter medication. So it's very important to distinguish normal versus abnormal. And then try and find the cause the correct way, and see if it's treatable or reversible.
So there's actually a lot to be done, a lot of conversations. And I know, Boitumelo, Salome has a hashtag Break the Silence, and I think that is the silence that everyone's trying to, no one's talking about these things. I mean, no one knows that there's like ultimate repercussions for not actually dealing with the issues. And I don't know if you want to just expand some more on what the work you guys are doing with Break the Silence.
So I think before I get into that, Doc, I'd never even considered the addiction to over-the-counter pain meds. So that's, I think, a new thing around having these conversations. But what we're doing in terms of breaking the silence is having conversations such as this, where we normalize conversations around women's health. I think we have to normalize, it has to be an inclusive conversation. One of the things that Candice does actually is we also need to expand the conversation around women into menstruators, because that is a broader discussion. So that's really the work that we're doing. We're saying, what is the conversation as a mother that you're having with your child? What are the experiences you had? How severe is your period pains? Because then you need to ready your daughter, if you've got girls, to say, you're most likely to experience this and that. This is what I experienced. This is when I started my periods. If you've already menopausal, this is when menopause came in. That family history, I think, also just helps that type of conversation. But we're really creating a safe space, and then also offering alternatives to, as I said, heavy menstrual bleeding, menstrual pain, PCOS, and also for women that are trying to fall pregnant, there is who have PCOS, there is actually fertility capsules for that. So there's a lot of work that we're doing around this breaking the silence and science for women.
And even breaking the silence, I think, Candice, just to this question for you, is that a lot of the conversations are had at home with mum and daughter and these platforms, but I think there's other avenues and other platforms we like at schools about the curriculum. Are the schools teaching the kids? Is it part of the curriculum? Are the churches having the conversations? Are we, it's in every aspect of our lives, wherever we are we having these conversations? Because it's all good and well, we're sitting here having these conversations, but are they also being had in different avenues? And I know you've got to have a lot of relationships, and you have a lot of workshops that you have with girls and in different areas. Can you just talk to us some more about that?
So I would say yes and no. When referring to the yes, menstruation is covered in textbooks, but it's mostly from a biology point of view of every 21 to 35 days, this is what happens, and this is, but there's never really any form of like management conversations, any form of demystifying
Social
myths and social aspects of it, and in particular, I think what I encountered when I was learning about menstruation was that it was just skimmed over. Just read those 3 sentences and then we'll go to the next more important biology section. And that was just really unfortunate, because half of the population menstruates, and we don't actually realize that menstruation is fundamental to human life. So why are we skating over it in schools? And then the aspect in terms of like, churches and teachers and staff, I think about the days when if I had period pain, I had to go and see a nurse. I had to go to the sick office and stay in bed. And just that mentality to say, you're grouping your period as a sickness. So I'm already viewing it negatively. And a lot of young girls would also therefore view it negatively, and not having the conversation with the nurse to say, the only reason why you're here is because you can't handle to concentrate in class, because you're experiencing hormonal fluctuations, which is dealing to your period cramps. So therefore you just need to rest, And I think there needs to be that shift in perception to say, our periods are not a sickness. Our periods are not dirty. They're not impure. But more than anything, it's just a natural thing we go through. And what we're going through is hormonal fluctuations, and we'll experience onset of symptoms before and during, and sometimes after. I don't know why after, Doc. Please tell me why. Why after? But we will experience these symptoms, and it's okay. Embrace them and make sure you treat them with care. And more than anything, don't see yourself negatively, because at the end of the day, it is your body. Your uterus, your womb, your vagina is a part of you. So you shouldn't see yourself negatively. So the education and curriculum is not there. It's not, the conversation's not being had. And I think that's why I started the workshops that I do, in changing the narrative of how we see periods and allowing young people to take ownership of their bodies, and just having that cohesion of education upliftment. So in our organization, we have this thing called Eduliftment for Kids, where we just educate and uplift people on social issues so that they can feel confident, so that they can make critical decisions. And that's what we ultimately do with periods.
And another place is workplace. I think a lot of people also experience, I've heard stories where, someone once, called into work and said, look, I'm not feeling too good, I can't come to work. And the boss was just like, but that's a period. You can just come in. Like,
Yeah.
and they don't realize that some people have severe issues when it comes to period pain. And I know a lot of companies are changing that, and they've brought in what you call a period leave. And I know that 360 Biomedicine and the GSG group as a whole has what we call a period leave. And I don't know if you want to.
So I think the thinking was we can't be in the space where we are providing solutions for women's health issues without starting at home, really. So we do have something called period leave for women that experience, whether it's extreme pain or heavy menstrual bleeding, whatever the case may be. I mean, I think it's also through this process that I discovered there's post-period flu and extreme migraines because of menstruation. So all of that we've now accommodate in what is known as period leave.
Dr. McKay, what's your take with the, the conversations, especially in the medical fraternity? I know, back in the day, I'm sure there was not conversations you were not having in class, or you guys were taught the medical side of it and not the social, and making it comfortable to have candid conversations beyond the medical. I don't know if you're seeing a shift in your space or if you in the thinking.
Well, I can only talk on a personal level because I was at medical school such a long time ago, and it's exactly what you're saying. Everything was done from a pathological point of view. Yes, there was some physiology behind it. And so when we see someone come into your rooms and someone sits down, you look at them already as a condition or as a disease.
Yes.
And I think it's time that we change, because you want to know the mum and the daughter there and telling me the pain is unbearable. The staying absent, the amount of bleeding is terrible. It's already to the point where one is becoming anemic, so your blood pressure is dropping. So you have to look at it more than just an illness. It's a person with something that is affecting them detrimentally, and they're not getting that attention or the that it deserves, and the empathy that should come with it. And I think that is where things need to change in terms of our conversation and our learning.
Yes.
That we need to feel their pain and feel it. And that's why I say I have no problem writing out a certificate. How many days do you want until you feel better, so that someone can notice that there's a problem? And then also being more proactive, so and showing that this is how we can try and prevent it, maybe lessen the amount of bleeding, lessen the amount of pain, so that you don't have to lose out on work or lose out on school every month for so many days. So it's from my point of view, there's a definite need for change there.
I'd like to add on. I think I've had so many personal experiences, but also hearing from friends of mine who have gone to doctors and we would say, I'm experiencing this, I have a period diary, or here's my app to show the symptoms, and you simply get like the statement, it's your period, so what? And I feel we need to have more conversations from doctors like you who say you need to be sympathetic and remove that form of a period is a disease or period is this, because oftentimes by receiving that form of discouragement, then I'm not going to go and see another doctor for another second opinion, because the first doctor I went to just told me to get over it. And I think also maybe there needs to be a shift in just how we treat menstruators during that time, but also the cost of treatment. I find that just for first time to see a gynecologist, you have to do so much. Pap smear, ultrasound, external, internal, everything needs to be done. And it's so expensive, and it can be so discouraging to then just treat yourself. And it's something that also I think needs to be changed policy-wise. Maybe we need to have something where these things are subsidized, or something that allows us to continue to go day by day, because there are so many women that I know who have very severe forms of pain but will not see a gynecologist because of cost or because they had a bad experience at a clinic. And that's just unfortunate.
And Dr. McKay, based on that, do medical aids, do we find that some medical aids do cover issues that have got to do with menstrual problems, or is that something that medical aids are not yet having on as part of an offering?
To be fair, the funders do cover the medication, they cover the consultation. But to add to the issue about gynecologists, one of the big issues is that most gynaes, probably all gynaes and most specialists, are already what we call contracted out. And so there's a cash fee up front, that one has to pay, which can be exorbitant.
Yeah.
But again, maybe just to draw attention to us as family practitioners, one of my mentors, Professor Harry Sefter, always said the GP is the captain of the ship, and things should start with us. And we should be able to handle all that without our patients feeling that my family doctor does not listen to me, therefore I need to see a gynecologist, and therefore I need to fork out all that money that could comfortably be spent on the medication, on things like the heating pads and the oils and everything else that goes with it. And so there needs to be that change. Yes, the gyne is there for a specific purpose for the more serious things, but something as that our patients have to deal with on a monthly level, like menstruation, should be something that every family practitioner should be able to handle comfortably, empathetically, and to the advantage of our patients.
Yeah, and this speaks to accessibility to good health, to products, having them readily available as and when. Boitumelo, just to touch on that, Salome products are available. I don't know if you want to give us some more about where our young ladies and our moms can get the products and.
So we're available, and most of the medical aids do actually cover if you buy the meds. But right now we are on Take a Lot, we are at Clicks, and various other independent pharmacies, so people can actually get it from there.
With no script, really over the counter.
With no script, you can actually go. I mean, we do also, as a business, say some of those is when your doctor has ruled out everything else. There are certain conditions where people still need to go to their healthcare professional before, but for people that know this is just heavy menstrual bleeding and nothing else, then they can do that.
So I think it's important just on that level to distinguish what we call primary versus secondary dysmenorrhea. Dys means bad, menorrhea means referring to the period. So period pains or menstrual cramps or having a bad period. It's important just to distinguish that we should help our patients distinguish between what's primary or secondary. Primary is the younger girls, and they are no abnormalities. There's nothing wrong with the womb, nothing wrong with the vagina, nothing wrong with the ovaries. Everything's working perfectly, but you have painful periods. And in that sense, absolutely, use whatever works for you. But usually the older ladies, when they have, especially if it's a later onset, they've been fine, and suddenly the periods become very painful, or the bleeding is heavier. That's we call can be secondary dysmenorrhea, where there's some underlying issue. And so the warning there is be careful of just rushing off to take something, rather have it checked out. Make sure that your gynae or your doctor's told you there's nothing wrong, after having been fully investigated for any abnormalities of the urinary tract system or the gynecological system, the organs and everything, and then you're good to go.
Good. Boitumelo, one thing that I've always been, I always question is what I put in my body. And I know you guys said you have natural products, and I know people worry about, are the products harmful? So yes, it's natural. Is it effective? Is it harmful? Can you give us more info on what your products, have to offer, and are they going to be harmful or not?
Okay. So as I said, we're an alternative what's already on the shelves. The products are not harmful. And there is lots of research behind these products. So if you look at the heavy menstrual bleeding product, it's got extracts from shepherd's purse, which is a herbal extract. And that also has been used for generations to treat things like nosebleed, and also, to treat wounds. So that is the base ingredient of that particular product. You can use it long term with very little harm, I think, to the body, because as I said earlier, we do go through our periods for decades. So you do want to actually get into something that does not harm you in any form whatsoever. So there is none.
Yeah, I think that's an important point for us who are the prescribers of medication to our patients, because traditionally, from a Western medicine point of view, we use a combination of anti-inflammatories, analgesics or painkillers, and antispasmodics, which relieve the spasm, the cramps, as it were. And the problem with the anti-inflammatories is the gastric side effects. So stomach ulcers, gastrointestinal bleeding, reflux, things like that. And then on a long-term basis, together with analgesics or painkillers, is the issue of kidney damage. So you get what we call analgesic nephropathy, where they can be harmful to the kidneys. We get the issue of dependence, especially many of these analgesics are what we call combination analgesics, and they contain things like codeine, which can lead to addiction.
Wow.
So it's very important that we number one, educate our patients. Number two, that especially if they're going to be using it for many years, that we warn them of these addictions. And us as the prescribers need to be very, very circumspect how we prescribe, and to pick up those who are perhaps overusing or even abusing. So the fact that our patients can have more of a choice is a good thing.
Good thing, yeah. Candice, I know you probably get a lot of messages and DMs and whatnots about, people coming to you and say, look, this is my issues and my conditions, can I get help with this? What's the main stuff that really sticks out to you? What are the common problems that stick out to you that you get from the young girls and the mothers who,
I think it's the issue of, the assumption that you have to bleed for 3 to 7 days, and one bleeds longer, there's something wrong with them, and if there's a combination with pain. And I think oftentimes I always just say, always make sure you track your cycle. I think oftentimes as menstruators we just say, oh, my period has started, and then keep it moving. But it's always important to track your symptoms, because if you ever experience something that is not normal, you can therefore go to your doctor and say, all of a sudden I'm experiencing pain. All of a sudden my period, which is usually 4 days or 5 days, is now all of a sudden 10. Why? And that will give you a stronger ability or stronger record when your doctor then says, well, it's your period, get over it. You'll be like, no. My record shows. My record shows that it actually isn't. So oftentimes it's really just asking, is it normal to have this amount of days of bleeding? Is it normal to have this type of pain? And I mean, I always tell them, I'm not a medical professional, but I do think it's always important to ask yourself, how was your previous cycle? Because if you didn't experience that with your previous cycle, then definitely go and check with your doctor now. And I think the combination of birth control pills as a solution to resolve it is something that I think a lot of people try to jump on, but it's like, don't always think the birth control could be your immediate solution. You have to see a doctor, and perhaps your doctor has an alternative to, rather than just jumping on a birth control pill or any form of birth control alternative. Yeah, so it's always interesting just seeing the different types of messages that come through, and I think oftentimes we just need more educational resources that don't necessarily emphasize. If I had to Google, I'm experiencing pain and there's this type of bleeding, it'll either say two things: you're pregnant or you're dying. And I think that gives some form of fear, right? So I think it's really important that we have resources, or just more doctors that are hands-on and available just to answer these messages, instead of having to feel discouraged to go and see a doctor.
Understanding your body is also, I think it's crucial. I think women are getting to a point where I do want to know my body. I do want to understand my body and what is actually happening with my body. And in the past we didn't. We just went with the flow and we were like, thank goodness it's over. But now I think understanding our bodies, so that when I do go see a Dr. McKay, I can say to him, this is what's happened, and my previous time, this wasn't happening. So it's us knowing and also being informed and owning
getting period apps. I find we live in a very digital world now. So we have a variety of period apps that inform you when your PMS is coming, informing you when your period is coming. And you are also able to log any form of symptom. So you're able to say, okay, today I've had cramps with headaches, and I've also experienced, my mood, my energy is this, and I also experiencing this. It's so important to just have that diary, because you can also share this data with your doctor to say, okay, for this month I've experienced this, I experienced that. It's really, really important. I do the same. I download my data and export it to my doctor, so that he has an understanding of what my cycle's like.
For me in medicine, the most important word is change. And a doctor can't argue with the word change.
No, not at all.
If you come in and say, this is how my body works, and its change is doing this, and be it gynecological, gastrointestinal, any symptom, any system of your body, it's a red flag.
Yes.
It's a red flag. And any deviation from normal is a problem. It must be addressed. And if your doctor's not listening to you, change your doctor. Get help somewhere else.
Absolutely. Boitumelo, what's your hope with #Break the Silence? In an ideal world, what would you like to see having changed the narrative in the society with our women, with our young girls? And what role is Salome going to play in changing that?
There are two things in an ideal world. One is to stick to my period diary, like Candice. That is what I'm now going to do. It won't be up in my head. But I think it's being able to have these conversations that we are having now, but in terms of actually starting a ripple effect, that there's a sisterhood. As friends, you're able to do this and have these kind of conversations and actually be able to say to your friends, I've been bleeding for about 8 days. Does this happen to you guys? So people can be able to, if you haven't even gone to your doctor, say, no, this is not normal. I would also like to see more women taking ownership of their bodies, understanding where the changes are, but also understanding, is what I'm putting inside harmful or not? And how, if it is harmful, what is available for me? How do I change that? How do I take ownership of the next 10, next 20, next 30, next 40 years? Because this vessel is supposed to carry you and do a lot more for you. So I think that is really what I'd like us to do in terms of breaking the silence.
Lovely. And Candice, in your space, I know you have so many plans, and I know you've done great, amazing things.
Yeah.
And I'm sure you have more that you'd like to see happen. And if you could share with us, what are your perfect world?
I think perfect world will again have to ensure that the next set of menstruators who are about to menstruate are meeting this first event with celebration rather than fear. I think in a perfect world, if I was president, I would normalize period parties.
Yes.
I would definitely say, if someone starts menstruating, let's get a red velvet cake, bring all your trusted friends and family, and let's just normalize sharing trusted information with trusted people, and not coming from a point of, don't do this, don't do that, you could be dying, you couldn't be, it's just a scary time. So I think I'd want to have a more period positive world than that. I'd also want us to have more inclusive conversations about menstruators. I think, you know, with menstrual activism, we've been seeing a lot of trans people, intersex people coming out with their stories to say they menstruate too. So is medicine catering for that? Is our health practitioners catering for that? And just having that inclusivity in menstrual activism is so important. And more literature, I think. More period literature, more content to consume. I'm happy to announce that being the 28th of May, we have dropped a book called Flow, the book on menstruation, with Kwela Books, which will be launching at the end of August. So that is going to be, I think, the first, you know, period book in this country that has conversations about what it means to have a normal period, what it means about period politics in this country, but also just menstruators menstruating. What does that mean, and what does that look like in South Africa? So yeah, period positive world just means having it in celebration rather than in fear.
I'm for that. Anything to celebrate, I'm for that. And congratulations on your book, by the way. Dr. McKay?
Yeah, I think from my point of view, it's important that we have these conversations, but that we use the words menstruation. We use proper medical terms.
Yeah.
You know, I'm the eldest of 5 children. I have 4 sisters. I can't remember anyone mentioning the word period or menstruation.
Yes. Wow.
And it was some auntie's name.
Yes.
You know, they just knew it was
my auntie's here, Aunt Flo, Auntie Flo.
Aunt Susie or something. It was one of those, you know, so it's important that we talk the talk.
Yeah.
Yes.
We use the words, you know, talk vagina,
Yes.
talk, mention and understand what it means to menstruate. What is happening in your body from the ovaries going down to the womb and shedding and everything. And then and once you understand the terminology, know how your body works, and once you're empowered to know how your body works and what is normal, it then becomes much easier to establish what is abnormal.
Yeah.
Because any deviation from the normal is abnormal, and that's how you can pick up that and just instead of just rather accepting that it's the same old, and then one day you land up in trouble. I can't have babies, I'm infertile, or I have cancer, or all sorts of things, God forbid. So for me, it's all about this conversation. Equipping, empowering, talking, and doctors too. Doctors need to empower our patients. I like to draw pictures. Come, here's a pad, let me show you exactly what's going on. Draw, this is what's going on. And I think if we can start on just a small level, this is a start, and moving on in terms of my colleagues, we can get somewhere to make sure.
I really do hope we continue these conversations, and from different, from business activists, from the medical space, I think people coming together from different aspects and having those conversations will make a huge difference. Definitely. Thank you very much for joining us in our candid conversation about menstruation. For all your comments and questions, please do them in the comment section, and we will answer them as best as we can. And we look forward to seeing you guys next time. Thank you.